A critically ill patient with acute respiratory failure presents with inadequate oxygenation and ventilation. Manual ventilation is inconsistent and unsustainable over extended periods, making it difficult to maintain stable respiratory support. Acute respiratory distress syndrome, pneumonia, or chronic obstructive pulmonary disease exacerbation can impair normal gas exchange. This results in hypoxemia and hypercapnia, increasing the work of breathing and leading to respiratory muscle fatigue. Without ventilatory support, prolonged oxygen deprivation and carbon dioxide retention increase the risk of organ dysfunction. Impaired lung compliance and increased airway resistance reduce the ability to achieve adequate ventilation. Ventilation-perfusion mismatch further compromises oxygen delivery to the bloodstream. The inability to maintain appropriate tidal volume or oxygen concentration limits effective respiratory support. The Draeger Evita R. V600 intensive care ventilators is designed for both invasive and non-invasive ventilation. It supports adult and pediatric patients to incorporate advanced monitoring capabilities with lung-protective ventilation strategies. The ventilator delivers controlled tidal volumes and airway pressures to support gas exchange. The fraction of inspired oxygen is adjustable from 21% to 100%, allowing precise oxygen delivery based on patient needs. Real-time monitoring of flow, pressure, and volume enables continuous assessment of respiratory performance. A high-resolution touchscreen interface allows intuitive control and visualization of ventilation parameters. Integrated respiratory monitoring displays waveforms and measured values to support clinical decision-making. The tidal volume range is appropriate for lung-protective ventilation strategies. Clinical workflow begins by connecting the ventilator to oxygen and compressed air supply. The patient is intubated or provided with a non-invasive interface. The clinician selects the ventilation mode and sets parameters based on patient condition. Airway pressure, tidal volume, and oxygen saturation are continuously monitored. Settings are adjusted according to blood gas results and clinical response to optimize respiratory support. The system supports lung-protective ventilation strategies and enables low tidal volume ventilation for acute respiratory distress syndrome. Potential risks include barotrauma, volotrauma, and ventilator-associated pneumonia. Lung protective settings help reduce overdistension of alveoli, and continuous monitoring enables early detection of complications. The Draeger Evita V600 provide controlled mechanical ventilation for critically ill patients. By integrating advanced monitoring and safety systems, the platform enables precise and adaptable ventilatory support.